Yeah.
So in allopathy, in physiotherapy, we have too many ethical considerations. I mean, if we are performing any kind of rehabilitation or treatment, conventional treatment also, we take ethical committee we take a
Approval.
permission.
Approval.
So in alternative medicine, are there any ethical concerns which we have to take?
This is a very beautiful question. This space is being played by the media influencers, gimmick masters. When you open your Kannada TV channels, you'll get magnetic therapy available, 10 branches in Bangalore. You know, they what they do is they don't know anything. They do IFT. There is a machine which is China-based machine which they'll do IFT. IFT they'll as if they'll do it in a different way of rubbing it on the body, lower back and all those. They'll put a magnets. So there is no governing agency. If you want to apply, you can apply to some Calcutta based alternative medical university. You pay the fees. Exam paper they'll send you home. You take your time, 1 month, 2 months, 3 months, write all answer sheets, send it back to them, they'll give you certificate. So there is no regulatory body, there is no governing body, there is no fixed protocol, there is nothing. And this gap is filled by majority of the idiots. I heard one of the person who charges, whom I was sitting as a panelist in one of the public TV, who charges 30,000 rupees for 15 minutes for two questions. Jyotish. So when these people are into the scenario of popularity, availability, money and all, why can't the hardcore trained people like physiotherapists or doctors should enter that field, give it an evidence-based outlook and earn better money? What is value worth of Ramdev Baba? Example you take. Whatever, all those gurus we met last 14 years, we used to go and approach them, ask what you're doing, how we are doing. I was sitting in one of the rock and I got enlightened and all those things, those stories they'll tell. But basically it is a Hatha Yoga, Patanjali Yoga and 112 techniques of Vijnana Bhairava Tantra. I'll tell you how beautifully I can correlate. Vijnana Bhairava Tantra is a science. Bhairava is a science of Shiva. Tantra is a technique. So Shiva will be telling different sutras, techniques to Parvati, his wife. She'll say, one time I feel like a mother of this world, one time I feel like I want to punish all the people, why my mind is fluctuating, changing and all those. Then he'll give some 112 techniques. And it is now majority of the books have been destroyed and all those. But the beauty of this is, first technique of Vijnana Bhairava Tantra is breath awareness. Breath awareness has become Buddhist main technique is mindfulness breathing. When somebody says mindfulness breathing, we'll say, oh, I know. But from where it is derived? It is derived from this. Some guru says, I got okay, this yeah, chakra enlightened and all those. I was sitting in a rock and suddenly I got enlightened. It is there in the book, same book. Permutation combination of this, we are making it in the form of meditation and giving a new name. Deep tissue massage, somebody is saying. Deep tissue massage, you are pressing little harder, trigger points are activated, Golgi tendon apparatus is activated, not superficial, just skin and the same thing I can say, okay, Dr. Sunil's integrative deep tissue massage techniques. You can make. Why I am giving this correlation is, we are going in a conventional manner. We need to, these people are your competitors. ಅಲ್ಲೆಲ್ಲ ಹೋಗ್ಬೇಡ್ರಿ ಫಿಸಿಯೋಥೆರಪಿಗೆ, ಡೋಂಟ್ ಗೋ ಟು ಎನಿ ಫಿಸಿಯೋಥೆರಪಿಸ್ಟ್. ಇಂಗ್ಲೀಷ್ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗ್ಬೇಡಿ, ಬರೀ ನಿಮಗೆ ಅಡ್ಮಿಟ್ ಮಾಡ್ತಾರೆ. One way that part is true, I am not saying no. I give one homework for you. Check out the top 10 hospitals of Bangalore. check the investors of Bangalore. Post COVID, investors became changed. For example, Manipal has been added by a company based on Singapore. 59% legal investment, 79% illegal investment. Policy Bazaar has a 100-bedded hospital. Why? So there is a nexus between, this part is a nexus between insurance, doctor, hospital, lab, other agencies in between. So right now, are you able to understand me very clearly, I think? Is it patient centric or commerce centric? Totally, it's commerce centric. If I get a patient, the doctor may charge 100 rupees, 200, 500 rupees. From here, this will send to this person. This fellow feels, okay, if I operate, I can charge less. If I send to Manipal, I can charge more. He'll send to other hospital. They will get some 15%. He'll get some 15% cuts. This is a fact, hard fact of present scenario. Another hospital give you something. Lab person will give you 30 to 50%. Agency will give. Insurance agencies like Policy Bazaar, even though it is recorded. Policy Bazaar, why you're into insurance? Why you need to own the hospitals? Because you want to control. You want to control. Why the Westerners are interested in investing in India? Because it's a control system. Now the present healthcare scenario, anybody where you are charging, hardly physiotherapists are charging 300, 400, 500. Is it sufficient for us? It is not sufficient. The same small operation used to do for simple piles operation 20, 30,000. Now they will do 1.5 lakhs. Patient also involved in this. How? Sir, ನಮ್ಮದು ಕಂಪ್ನಿದು ಇನ್ಶೂರೆನ್ಸ್ ಇದೆ ಸರ್, ಮಾಡಿ ಪರವಾಗಿಲ್ಲ. Statistics says 44% of non-essential operations, non-emergency operations can be prevented simply by second opinion. Simple one, second opinion. Gallbladder can be saved. Appendix can be saved. Unnecessary simple exercises can long term help you for renal cyst. Long term it will help you, but they want to operate, pop it up. So healthcare scenario is bombing. It is going to change the entire outlook. Now there will be big players. Vikram Hospital was big. Columbia Asia Hospital was very big. Kaveri Hospital was very big because I personally know these people in circle. I worked for Vikram for 2 years as a same concept. I used to tell this. So one of the marketing director came. He told this to, you are giving so much of knowledge and content. We know this. We want to hire a marketing person paying 1.8 lakhs to create a fear-based scenario to get angiogram done, to get this investigation, that investigation, and all those. And you want to teach the people rhythmic breathing technique or cyclic breathing technique, JPMR, Jacobson's progressive muscular relaxation technique, and you want to say that some people can live for 100 years without anything. You are actually spoiling the game what we planned for. So that was a very hard-hitting answer he told very harshly. Then on, I start teaching more of yoga, Ayurveda, some of the physical exercise, isometric neck exercise, isometric back exercises, how all those postural corrections. We'll do one postural correction, just like a game we'll do. My class style is vague, but there is a message in the sentences, in between the sentence where there is a silence. If you're able to grasp, you feel. Otherwise, it will look very vague. This will be little technical. You feel nice. So another important part for physiotherapist, if you use wellness, very interesting. Place like Malaysia, 37% of the companies should allot for healthcare. Any people doing wellness activity, 37% of the company money will go. 17% of the money will go to the Bhumi Putras, the local Malay Muslims. For their development, the money is reserved. So there is wellness, and they want to prevent migration from Malaysia to nearby countries. Singapore is doing so well. Malaysia people just migrate. So to retain that, there are a lot of wellness activities. Interestingly, more than 80% of wellness industry, there is no doctor at all. Is it interesting? I conducted workshop medical yoga. I just named it like a medical yoga, doctor teaching yoga for Mercedes Benz for 3 months. So I charged around 5 lakhs. Still yet to come. It is not coming till 5 years is almost over. So when you see 80% of the people are not in wellness industry. We are in an industry which is more of a hospital. So we also need to add hospitality. Same physiotherapy, same range of movement exercise, I'll teach it in a different way. For example, you want to do it, three of you can, four of you can, four boys can come. Okay, Allah, correct one. You can come. I'll teach you shoulder loosening technique. See, shoulder loosening technique plus team building program. For example, I'm incorporating two things. One is shoulder stretch. Second one is team building activity. You can. So all of you, four of you, can hold hands crisscross like this. You can, like one circle. Crisscross. So team building in this is you also can do once they're done, or you can do. I will take a picture. You can do. Okay. So idea here is I am just giving an example of I want to use a shoulder stretch. In this I want to do a team building activity. So there is one corporate team where they are paid, they paid you some 10-15,000 for 45 minutes workshop. There I'll teach this postural training, which I'll teach you now, and simple training like this. So idea of the team is you are not going to let go of the hand of each other. So psychologically, you are as a part of team. So once I say right, you pull the right hand without leaving the other one. You should feel the stretch, gentle stretch. As you do a physiotherapy, how do we don't just stretch like that, based on the each person's range of movement is different. Each person's resistance levels are different. In that way, do it. So let us start. Right elbow straight as much as you can. Pull the right hand as you can. Hold it tight. 1, 2, 3, 4, 5. Release. Left. Pull the left. 1, 2, 3, 4, 5. Release. You can do. Right. Keep doing. Stretch it fully. Elbow straight. See the difference. Elbow straight. The stretch will goes to the tricep, bicep, trapezius. Left. Okay. So team building game. Same hold like this, and I want you to do a flowering. So stretch your hands backwards when you breathe in. Flower opens up. Slowly bend back. Bend down. Flower becomes petal. Lotus bud opening up kind of exercise. 1. So in this I am using rectus muscles. Bend down. 2. Okay. Done. Release. You want to do? Better. So does it give an example of a team building activity and the stretch? So we'll do the postural correction program. All of you can come. All of us will use that last place. We'll go there at last. It's an individual. See, idea is posture is being physiotherapy. We just maintain external acoustic meatus, ear hole, acromion, anterior superior iliac spine, lateral part of the knee, 1/3 of the ankle, 2/3 of the ankle. If I draw an imaginary line, there is a center of gravity. I'll simply ask people to analyze by look straight. I'll say like this. So for example, if you're looking at me, you can see a little bit of tummy protruding. So there is a little lordosis for me. There is a tendency for back pain. Like this, we can evaluate. So we'll choose one is a evaluator, one is a person. Just you stand. You should not be conscious of this. You just stand as you stand normally. Then other person will evaluate. You can come that side. I can we'll use that last space. So one will become. So ask them to stand like this. If you want, you can use the pen. Close one eyes and you can see the alignment. Or otherwise, you can do normally also. So choose a partner, one to one. The other person who is not a partner, who is a patient, you take consider yourself as patient. Let us, you do not use a logical mind right now. Don't correct yourself, anti all those things you forget. You stand as you stand normally and look in one direction. You can give the instruction one kade nodi. And no, who's evaluating who? You are evaluating. Okay, you can, he can be little far, a little far. Ask him to stand normally. The evaluating doctor can see the external auditory meatus, ear hole, acromion, anterior superior iliac spine may not be seen, but behind the elbow you can make it out. Lateral part of the knee, 1/3 of the ankle and 2/3 of the ankle. See, is there any lordosis? Is there any protrusion of abdomen? Is there any kyphosis? Is there any hunching? Is there any buffalo hump? Is there any neck changes? Is there? So, but just simply by looking at a distance, you can make out that this person might be having trapezitis, this person might be having kyphosis. He might be reading too much, like MBBS doctors will be usually. Change the role and see the difference.